It hurts so much. When will this pain go away?
Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life.
Okay, editing Carrie here, just jumping in. I want to ask you a question. Put it down in the comments. When you keep listening to this video, count how many times I say or typically. Okay, back to the programming. Kind of 3 reasons why you might be feeling gas pain after having surgery. They might not explain this to you before surgery or at the hospital or at the surgery center. And now you're at home and you're feeling the pain and you're not understanding why. I think it's always important to understand why. There might be 3 reasons. One is you actually have gas within your intestinal digestive system. So that gas that you typically feel like you got a burp or fart, that kind of buildup of gas. That's one reason. Another reason is that anesthesia kind of gets trapped in our body and sometimes it just doesn't get released as quickly as we want it to. So you might feel like some pain in your shoulder area. That's typically the anesthesia trying to get out of your body. So that might be one reason why you're feeling pain. And then another reason that they just kind of don't explain to you, we just assume it's intestinal or digestive, kind of trapped within our digestive system, that gas. But sometimes, especially when we have laparoscopic surgery, it causes gas because what they're doing is they're actually inserting kind of gas, a type of gas, into our body so that it can make the area a little bit bigger so that they can see what they're doing as well as get their instruments in. So they're actually kind of distending, they're pushing, they're expanding our abdominal area so that they have a good surgical space. At the end of the surgery, typically what they're doing is they're allowing the space, the area around that they needed to kind of expand. They're allowing it to, and sometimes they have to assist it to deflate. But it was something that they did do to our bodies, and so you might feel the effects of that. But also there might be some gas is still trapped. Or the area didn't get completely deflated. So that is kind of what's causing that gas discomfort that we think is internally, but actually it's around the area they were working in the outer part of our abdominal area. So you might have those 3 things working together. It might be 1 out of 3, it might be 2 out of 3, but it might be 3 out of 3. This type of pain is something that actually, I know it's hard to hear right now, but it is temporary and eventually it will go away. No matter what, though, it still feels and hurts a lot. So let's talk about some things that maybe can help soothe it or even get rid of it. I know you heard them say it. They said it to you before. They said it to you in the hospital, but I am going to say it again. Walk, 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 move. Whatever you got to do, it's your job to get up. Walking is the best thing for this. Walk around your kitchen table, walk to your mailbox, walk to your bedroom, walk to the bathroom. It's your job. You have to make it a priority. It helps your bowels and work with the constipation feelings you might have, but it really is your number one thing to do to get rid of that gas pain that you're feeling. Now, for some of us, this might be like absolutely not able to do. Try to do it on your bed if you can on the floor. Try to do some leg raises. It helps you kind of relieve the gas, gets things moving. Lie on your back, place a pillow, or lie on the bed, place a pillow under your knees. Get someone to help you if you need to. This might be easier said than done. Slowly raise your right leg towards your stomach with your knee bent. If you can, don't push it. This might be super hard to do right now, but just try to move, raise your legs a little bit, try to bring them into your chest. It just gets things moving. It expands the muscles in your abdomen and it just helps to relieve some of that gas within your digestive system and dissipate it from what they did to get some more space around your digestive system. If you are going to try some medications to help you get rid of the gas, really know what you're going into. I always recommend go as natural as possible. You don't want to use too many, too much. that might go against what you're trying to do. And if you have any concerns, always contact your bariatric surgeon. Look in the resources that they gave you to make sure that you're not taking something that you shouldn't. But sometimes the over-the-counter medications can help you pass the gas. You just don't want to be taking them all day long. Gently massage or rub your abdominal area, your stomach, to help you get rid of some of that gas discomfort. Make a fist with your left hand, push your knuckles gently into the right side of your stomach, and using gentle pressure, then roll your hand toward your chest, across your abdominal area, and then down the left side of your stomach. So you're kind of making a square or even a circle. This type of massage just kind of helps relax your abdominal muscles and just stimulates activity in your bowels if you need to, as well as just kind of getting that gas, that extra space to get moving so that it releases. If you haven't tried this already, you can try using a heating pad, put it on your abdominal area. It might help to ease the pain or at least ease the gas discomfort. Just remember, for some of us, applying a heat pack might dissipate that kind of gas discomfort, but it might increase swelling in our abdominal area. So you don't ever want to do it more than 15 minutes at a time, and just keep checking to make sure that you're not causing something that you don't want to be causing as well. Just a note about some pain medications now. You want to have this conversation with your bariatric surgeon, but pain medications can cause constipation, but it might be something you want to look into to kind of help ease the discomfort if the gas pain is so painful that you can't even think or move. But you just want to make sure that you're checking with your healthcare professional, because some pain medications, like I said, can increase constipation, and some can actually cause nausea, especially after bariatric surgery. Our bodies, it is a journey of self-discovery. One day can change the next, but you always got to be super alert to what your body's experiencing. And you always want to make sure that if you're taking something, you want to see how your body reacts. So tell your doctor all these things, and you want to make sure that whatever you're taking is something that they are good with as well. You're probably already doing it, but make sure you're wearing very loose, comfortable clothing, especially the first couple of days after surgery. You don't want anything pushing down on your abdominal area, because that'll just make the discomfort worse. If you're wearing an elastic waistband, make sure it's not too tight. Is there something else you can be wearing? Because that you might not even realize that that's pushing on your abdominal area. If your doctor says it's okay, try sipping on some peppermint tea. It's known to relieve abdominal pain caused by gas discomfort. So if your doctor's okay with it, try some hot peppermint tea. Just relieve your body, relax your mind, but also it can help with the gas discomfort. Now, this is another thing to check with your doctor. Some bariatric surgeons are just really against this. Some are okay with this, but chewing gum has been shown to speed up recovery in regards to the gas discomfort. There's some research and evidence showing that chewing gum after surgery helps decrease the amount of constipation you experience, especially after laparoscopic surgery. So chew gum every 15 minutes. I would suggest, of course, sugar-free gum. If you can't chew gum, just the motion of chewing can help matters with gas discomfort and kind of getting your bowels moving so that you can relieve some of that gas discomfort. Another thing to remember when you are chewing gum or using the chewing action, try to keep your mouth closed. I know that sounds kind of obvious, but otherwise you might end up taking in more air, more oxygen, and making the gas worse. Most of us right now have been told not to use straws, but like every program is a little different. Sometimes they don't even mention that. But at this moment, no matter what your program allows or doesn't allow, it's really important to avoid straws right now. It's super important to take your time, be very slow, methodical when you're eating or when you're taking in your protein shake. So it's important that if your symptoms where you feel nausea, you have extreme bloating, vomiting, abdominal tenderness or pain to the point where you can't even touch it, and then you're having super problems, passing gas. I know it's discomfort right now, but if your symptoms are super severe and you are concerned, you always contact your surgeon or your doctor. This was a short video. I just wanted to make sure that you know that this is a normal thing. It's typically something that everybody experiences. It's kind of what we need to get through, especially the first 3 days, maybe even up to a week. Be well, relax. It's our job. It's something we need to do. You'll be stronger on the other side, and you got this. Take care and see you in the next video.